Hello, in this video, I'm going to be talking about health anxiety after cancer. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, often in response to comments and questions you have. So there's always something new to watch. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report. So after somebody's had cancer, or even a cancer concern that ended up not being cancer, it's really common for people to be concerned about every symptom, every ache or pain or cough or thought triggers fears. What if the cancer's back? What if I'm missing something? What should I be doing? This is really normal. This happens because after an event, a health event, which is really a trauma, something that interrupts the story of your life, we go into this hypervigilance state. You're vigilant for everything. And by calling it hypervigilant, I don't mean that it's pathologic. It's actually really normal. You have gone through something that disrupts the story of your life, and now you're attuned to every change in your body, around your body, even to things on the news, things that other people say, other cues in the environment. This video is going to be talking about cues in your body. So if you, let's say, went through cancer and its treatment, or you're going through it right now, and you get a new cough. Now, you might have a cough because it's a cold or a flu, or you have allergies, or you have asthma, or you have another chronic medical condition, but your body now interprets that as a threat. And so you go into this hyperdrive mode. You'll hear people talk about the saber-toothed tiger. We are attuned to detect danger. And when you have a symptom, I'm going to stick with the example of a cough, your body says, oh, this is a signal that I'm in danger. And it's natural and normal to not know what to worry about and what to say, oh, this is something that I'm used to, this is just a normal thing, because you are allowed to have a cold. You are allowed to have other medical problems, just like you did before, but now your body's especially attuned to those signs of danger. And your body will respond with arousal. So you'll get a high heart rate. You might be up at night. You might not be able to sleep. And it's usually at night when the house is quiet that people notice symptoms because there aren't other things to distract you. So it will be normal for you to notice something when you're trying to fall asleep. What that can lead to is storytelling, where you tell yourself, this is the cancer that's back. And you may find that you go into information hunting mode. So you may get up and start Googling, or may just stay in bed and look on your phone for what this means. You may start to tell yourself scary stories, as I mentioned, or you may go into avoidance. And that's the other response that people can have, where they just deny that they're having a problem, but it stays untended to. So you don't put it front of mind, but it's now in the back of your mind where it stays sort of curled up in the dark. So all of these things are normal reactions to a new unfamiliar symptom, or even one that's familiar, but now you are in an unfamiliar setting. You may also find that you're repeatedly checking your body, whether it's your surgical incisions, or you may be going into the doctor or asking other people, is this normal? You may be manifesting this state of hypervigilance by checking, whether it's checking yourself or going back into the doctor. Now, none of this is wrong. The question is it helpful? So there's nothing that's maladaptive about this. It's a normal response. The question is this helping you and serving you in terms of helping you feel better? So one thing I do want to say is it's always okay to call the office. If you have a symptom that's lasted for more than 5 days, that's new or unfamiliar, especially in the first year or so after cancer, just ask. If your medical team gets to say, this is not anything to worry about, you've made their day. You're not bothering them. The question is, does this help you feel better? If you're noticing that you're actually getting in a cycle where you're depending on people to tell you this is okay, and depending on scans, and depending on blood work, to show you that there's no sign of the cancer coming back, what you may notice is it actually isn't helping. So people can have non-specific symptoms, be seen by the doctor, feel a little bit better for a little bit of time, and then find that actually without that reassurance, they're feeling worse. So if this is you, this is the place where it's becoming less functional and more disruptive. And you may want to talk with your team about your reaction to this hypervigilance and what can you do to help calm your nervous system down. Again, I'd love to invite you to go to Yerbba.com, because at Yerbba.com, we take all of your information from your medical records, cross-reference it with the latest medical evidence, tell you about the treatment options that might be available to you that you'll hear about when you go from doctor to doctor, and the pros and cons of those treatments, as well as questions you can ask your doctor, including things like, when do I call you once treatment's over? Some things that can help are tracking your symptoms, not excessively, but just see how things are, not multiple times a day, but once a week or so. Writing about your concerns, talking with a good friend, engaging with people in a support group, because there you will hear just how normal you are and learn other ways that people have managed to deal with that stress reaction, that fight or flight, cortisol, adrenaline reaction. What are the sorts of things that have helped other people? It's also important to maintain a good relationship with your medical team and make sure that they honor your experience and not in any way diminish your feelings. Sometimes people will, healthcare providers included, want you to be at peace, and so they may say things that make you feel invalidated. Giving people the benefit of the doubt for one of these occasions is okay, but make sure that you feel seen and heard and understood by your medical team as you bring concerns to them. There are two other things I want to say. Learning how to manage your stress and learning how to take those stress hormones and become more familiar with what works for you is really helpful. So whether that's mindfulness or meditation or writing in a journal or talking with a good friend or movement and trusting in your body again, these are the sorts of things that can be helpful. So doing some strengthening exercises, working on your sleep, and we have videos about that, can help you deal with that stress response. There are some other things that you can do, everything from humming to things like patting your chest. I don't want to trigger the microphone, but you can even do this on your chest every other, like a heartbeat. That can help settle down your nervous system, especially if you hum along with it. And then finally, view your medical team as partners. Now that treatment is over, let's say, or you're approaching the end of treatment, view your medical team as still involved in your care. Although your visits will be less common, your medical team is still there for you. I hope this has been helpful. I've covered a lot. Thank you for watching, and we'll see you next time.